So dear students, so today our topic is blood coagulations. So regarding the definition, so coagulations of blood is also known as the blood clotting. It is a process by which the blood which can loses its fluidity and becomes a semi-solid like substance. Okay, and within a few minutes where the injuries occur, so where the hemorrhage is present, so where the blood can loses its liquidity or fluidity and become a solid like jelly like substance or thread. So that entire process was known as the coagulations of blood or blood coagulations. So actually the normal time for the blood coagulations is 3 to 5 minutes or 2 to 10 minutes. Okay, so normal time for blood coagulation is the 3 to 5 minutes and 2 to 10 minutes. If it is more than that, it is known as the abnormal. If it is less than that, then also considered as the abnormal. For example, if the blood coagulation time is less than 3 minutes, it is responsible for blockage of the blood vessels, because within fraction second the blood can be clot. Okay, it can create the problem in the flow of the blood where the clot is forms. Okay, so that's why the coagulation is always it should be 2 to 10 minutes or 3 to 5 minutes. If it is time was more than 10 minutes, that is the formations of semi-solid like jelly substance at the site of injury or where the hemorrhage is present or loss of blood is present, then that was responsible for loss of more blood due to lack of the blood coagulation process. So that's why so normal coagulation time is the most important to avoid the various kind of the disorder. If the time decreases, then it is responsible to cause of atherosclerosis or blockage of the blood vessel or blockage of the supply blood to the heart. Then person was suffering from the heart failure or cardiac arrest or atherosclerosis or many other disorders are there, or even the person was suffering from a stroke if the clot is occurs in the brain. Okay, if it is more than that time, then loss of blood is more. Okay, so due to that the hemorrhage is occurs. Due to loss of blood, the hemorrhagic shock is occurs. So that's why the coagulations period should be 2 to 10 minutes. Okay, and the coagulation is also known as the secondary hemostasis. Hemostasis means balancing of the blood in our body or inside the blood vessel. So that process was known as the hemostasis, and the blood coagulation process or formations of clot, it is referred as the secondary hemostasis because it is the second stage where it can arrest the loss of blood from the ruptured vessels. When the blood vessels are ruptured, so loss of blood is present initially where certain hormones are released. Okay, like histamine, 5-HT, then serotonin. So many others are there, local autocytes. So they are vasoconstrict the blood vessels. So due to constrictions of blood vessel, the loss of blood is decreases. Okay, but that was the first hemostasis mechanism, and here the formations of clot, it is a secondary hemostasis mechanism. It can prevent the loss of the blood, and the blood coagulation process, it can require the various factors. So those factors are known as the coagulation factors, and as well as it can require the calcium and also phospholipids. So maximum coagulation factors, so they are the protein in nature, so they are manufactured in the liver. Okay, so that's why so liver play important role in the coagulation process or blood coagulation, because so what are the factors, totally there are 12 factors are involved in the blood coagulation process. Okay, so among them maximum coagulation factor, so they are synthesized or manufactured in the liver. So that's why the scenario or conditions of liver is also reflects on the blood coagulation process. If liver having any problem means, so these coagulation factor do not produces. Okay, if they are not producers means the blood coagulation process do not occur in the case of accident or any conditions injury, so where the loss of blood will be the more. Okay, then as well as, so this blood coagulation process, it can require the ionized calcium. Okay, so this calcium is available in the blood as well as from the intracellular sources, and also so they are required the phospholipids. So phospholipid is the main component. It is helpful for formations of the thread-like structure. So where the injuries occurs, so where the blood clot is occurs. So where the phospholipids, they can accelerate the to forms the semi-solid like substance, and as well as due to release of phospholipids, so they activate the platelets. Then the platelets, it can involved in the to regulate the blood coagulation process. So here the blood coagulation process means where the blood can loses its fluidity and become a semi-solid like jelly substance at the site of injury. So now my question is for you. So what is the importance of blood coagulations? Okay, कोई बोल सकते क्या? So what is the importance? So why the blood coagulation process required? So one answer already you know, to prevent the loss of blood. Then other, or what is the significance of blood coagulation process? So within 5 minutes you should be know the what is your time of blood coagulation through your practicals. So what is the significance? Okay, so if any blood vessels, if they are rupture means the loss of blood is taken place. Okay, so here due to presence of platelets in the blood, they struck the damaged places, then they are activated. Actually platelet in the blood present in an inactive form, and inactive platelet, they do not have any pharmacological action or physiological action. So when they are hit to the dry surfaces or rough surfaces due to ruptures of blood vessels, so these vessels become shrinkage. It becomes the dry. Okay, so due to that, the platelet are hit to here. Okay, so due to striking a platelet, the platelet are activated. So due to activations of platelet, so those platelet, they can form the plug at the site of injury. That is known as the platelet aggregations. So these formations of platelet plug, it can prevent the loss of blood. And after that, so these activated platelets, so they are released the various factors. Okay, or they can activate the various coagulation factors, or it can release the phospholipids. So those are responsible for the formations of the semi-solid like substance in the ear. So this semi-solid like substance is helpful for the formations of the new tissue, because when organ is rupture, then where the coagulation occurs. So that coagulation or formations of semi-solid like substance, it is helpful for the formations of the new tissues at the site of injury. So that's why the blood coagulation process is required for the wound healing or tissue repair or formations of the new tissue at the site of injury. And as well as when the bones are ruptured, where also the blood coagulation is occurs. So that was helpful for to join the damaged broken blood, that is the bones. So that's why in the bone formation, where also the blood coagulation process is most important. If it is abnormal, then the clot is present inside the blood. Okay, so where the small capillaries are there, so where that clot can be accumulate, then it can struck, then it can inhibit the flow of the blood. So that condition was known as the blockage of the blood vessels. Actually it is required for wound healing, it is required for loss of blood, but if it is abnormal, if it is more than normal, then the clot is present in the blood where the small vasculatures are there or capillaries are there, they where they can struck and prevent the flow of the blood toward the organs here. Okay, so that's why abnormal coagulation is create the problem, and normal coagulation, it is helpful for the wound healing. And as well as if you know the your blood coagulation time, if it is 2 to 10 minutes means your liver will be working properly. because the coagulation process is mainly depending upon the coagulation factors, and maximum factors they are synthesized from the liver. Okay, if liver is malfunction means then the coagulation time is increases due to lack of coagulation factor. So in the primary scenario, without any blood profile test, simply we can go for the coagulation time by using simply filter paper. So then you can conclude what is the scenario or conditions of your liver in primarily in the home itself. Okay, so that's why the coagulation process is the most important process. It is helpful for to prevent the loss of blood, and as well as it is helpful for the wound healing and repairing and joining of the broken bones. So next one is the regarding the coagulation factors. Okay, so coagulations of blood occurs through a series of reactions due to activations of certain group of substances, and these substances are known as the clotting factors or coagulation factors. So there are totally 12 coagulation factors are there. So their activation is responsible for the blood coagulation process. Without these factors, the blood coagulation process do not occur, or the blood do not loses its fluidity, it do not becomes the semi solid like substance. So that is the first factor is known as the fibrinogen. So this factor is synthesized in the liver. And factor 2, it is known as the prothrombin. It is also synthesized in the liver. And factor 3, it is known as the tissue thromboplastin, or also known as the tissue factor. It was synthesized from the damaged tissue or activated platelets. Okay, and factor 4, it is known as the ionized calcium, and source for calcium is a diet, bones, and as well as the platelets. In the platelets also the calciums can be stored. So during the blood coagulation process, when the platelets are activated, when the platelets are ruptured, so they release the calcium. So that calcium is acts as the cofactor for various blood coagulation steps. And the factor 5 is known as the labial factors or proacelerin. So these factors synthesize in the liver as well as the platelets. And factor 6, it is an unassigned factor. So that's why, so this factor is absent. Okay, so next factor 7, it is known as the stable factor or proconvertin. It is synthesized in the liver. Then factor 8, known as the anti-hemophilic factor. It is synthesized in the platelets and as well as the endothelial cells, the cells of the blood vessels. Then factor 9, it is known as the plasma thromboplastin component, or also known as the Christmas factor. So this factor is synthesized in the liver. Okay, next factor 10, it is known as the Stewart Power factor. It is synthesized in the liver. Then factor 11 is known as the plasma thromboplastin or antecedent. It is also synthesized in the liver. And factor 12, it is known as the Hagman factor. It was synthesized in the liver. And factor 13, it is known as the fibrin-stabilizing factor. It is synthesized in the liver as well as platelets. So that's why, so maximum factors, so they are synthesized in the liver. The factor 1, factor 2, then factor 5, factor 7, then as well as factor 9, 10, 11, 12, 13. So that's why the blood coagulation process is mainly depending upon the conditions and scenario of the liver. If liver having any problem or hepatotoxicity, then so these factor is not synthesized, then blood coagulation process time was more than the normal or increases. So that was helpful for to own healing process, and as well as knowledge about the blood coagulation time, it is helpful for to do the surgery. Okay, so during the surgery, for same surgery, for some patient doctor told to them, you keep ready for 2 pocket of blood. For some patients the doctor they are told you can keep ready for 5 pocket of blood, but the surgery is same, but one patient required only 2 bags and another patient is required 5 bags because of only the blood coagulation process time. If time is increases, then where the loss of blood is more during the surgery, so that's why the more blood pocket is required. If it is normal, then less blood is required. And as well as during the pregnancy, the doctor also they can go for the normal coagulation time, through which only so they having the knowledge regarding how much blood can be lost during the labor. Okay, in some ladies, so the doctor that told you do not, that is there is no problem, but some far lady the doctor told you need to give some blood. So that was on the process of the normal time of the blood coagulation process. So next one is the, so regarding the coagulation pathway, so blood coagulation pathway, so there are mainly three types. That is the intrinsic pathway, extrinsic pathway, and after both that is a common pathway. Okay, intrinsic pathway, it will begin. So when internally the blood vessels are damaged. So due to damage of blood vessels, the collagen is exposures. Collagen is nothing but it is a component of the blood vessels. So that exposure of collagen, it can releases the various internal factors like keratin, kinogens or autocytes. So those factors responsible for to regulate or to initiate the blood coagulation process inside the body are due to damage of the inside the body by blood vessels. Due to damage of blood vessel, so these collagen factors are released, then they can further activate the factor 12, 11, 9 and 10. Okay, so extensive pathway, that is external injury or tissue trauma. Due to any accident, the tissue can be damages or tissue may be undergo the trauma. So then it can begin the coagulation process. So that pathway was known as the extrinsic pathway. So where the factor 3 and 10 factor are responsible for the regulations of the extrinsic pathway or injury of the external tissues. And common pathway, after intrinsic and extrinsic pathway, so this pathway can be begins. So during the common pathway, the factors are involved like a prothrombin activator, thrombin, and as well as the fibrinogen and as well as the factor 13s. Okay, next one is the coagulation process or pathway. So that pathway was mainly intrinsic pathway and extrinsic pathway. So intrinsic pathway will begin so when epithelial damage or collagen is exposure. So due to expose of the collagens of the blood vessels, so these two factors are released. There is a kallikrein and high molecular weight kinogen. So these are known as the local hormones or autocytes. So where the injuries occurs, where only they are released, where only they can show the action, where only they can be metabolized and removed from the circulations. That's why, so they are known as the local hormones or autocytes. Okay, so the release of kallikrein and kinogen due to exposure of the collagen, so they can activate the factor 12, that is Hagman factor. So this factor is mainly synthesized in the liver and it is present as inactive in the blood. When it is subjected to the kallikrein and kinogen, then it becomes the activations. It becomes the factor 12 active. Once the factor 12 active is activated, then the blood coagulation process can be start. And further, factor 12, it can convert, that is factor 11, that is plasma thrombin antecedent, into factor 11 active in the presence of the calcium. Then further, factor 11, it was responsible for the activations of the factor 9 from the factor 9 itself Christmas. So all the coagulation factors in the blood, so they are present in the inactive form. Due to activations of the other factors, so they will be activated. So like that, after the activations of factor 9, so in the presence of factor 8, that is the anti-hemophilic factor and calcium, it can activate the steward factor, that is factor 10. And further, factor 10 in the presence of the labile factor and calcium, it can activate the prothrombin activators. Okay, from here the common pathway can be begins. So once the prothrombin activator is activated, it can convert prothrombin, that is 2, into thrombin. Thrombin is an enzyme. Once the thrombin is formed in the blood, means the blood coagulations can be continue without any damage of the epithelial tissue or collagen exposure or release of activations of the factor 10. That was known as the positive feedback mechanism. Once in your body the thrombin is activated means the blood coagulation process can be continued. So when the thrombin is activated, so this thrombin factor can convert fibrinogen factor 1 into fibrin. Then fibrin, they can undergo the structural changes, that is the polymer reactions. Then it can loses the strands of the fibrins. In the presence of factor 13, fibrin stabilizing and calcium, so where the fibrin tight blood clot will be formed at the site of the injury. It is the finally step where the blood, it can lose its fluidity and it becomes a semi-solid like substance due to activations of fibrin. That fibrin can undergo the structural changes, that is known as the polymer change reactions or polymerizations. In the presence of factor 13 and calcium, then semi-solid like substance is formed at the site of the injury. So that is helpful for to prevent the further loss of the blood. So regarding the extrinsic pathway, the external damage of the tissues or tissue trauma, it can release the factor 3, that was known as the tissue thromboplastin. So in the presence of glycoprotein phospholipids, so they are released from the damaged plasma membranes of the cells and as well as from the platelets. In the presence of factor 6, that is stable factor, so these activate factor 10, that is Stewart factor is present as a inactive in the blood, then it can be activated when external injury during the extrinsic pathway. In the presence of glycoprotein phospholipids, factor 7 is stable factor, in presence of tissue thromboplastin, that can activate factor 10, and further factor 10 activate the prothrombin activator in the presence of factor 5 and calcium. Once the prothrombin is activated, it convert prothrombin into thrombin, then the thrombin convert fibrinogen into fibrin, then fibrin undergo the structural changes, it loses strands. In the presence of factor 13 and calcium, semi-solid like substance forms. So that's why, so this the, from the prothrombin activated to the fibrin tight blood clot, this process or steps present in the both cases, intrinsic pathway as well as extrinsic pathway. So that's why it is known as the common pathway. And as well as due to exposure of collagens, the skin become the contracted. So to contractions of skin or blood vessel, the platelet can be struck, then the platelet can be activated. And platelets, so they release the various phospholipids, and those phospholipids further they activate the prothrombin activator, then convert thrombin into prothrombin into thrombin, then fibrin into fibrin, then finally they can form the blood clot. So like that, due to epithelial damage or damage of blood vessel, the blood coagulation process occurs, or activations of the platelet due to heat on the dry surfaces or any surfaces, then also the blood coagulation process can be continued. And as well as any external injury or tissue trauma, then also the blood coagulation process can be continued. So this is the blood coagulation process that was occurs in our body. Okay, once thrombin is formed in our body means the blood coagulation process can be continued without intrinsic pathway or without activations of platelet or without extrinsic pathway. The process still continue because thrombin, it is an enzyme, it is itself, it can activate the prothrombin, through which itself it can enhance its own synthesis through a activations of the prothrombin activated by a thrombins. So that's why, so this mechanism was known as the positive feedback mechanism. Once thrombin form means the blood coagulation process can be continued. So due to that, it is this step was known as the positive feedback mechanisms. So next one is the factors, so that can influence on the blood coagulation. So here certain factors are there, so they are decrease the blood coagulation process, and these factors are helpful for to keep the blood in the blood bank, or we can store the blood for longer duration. And some factors are there, so they enhance the blood coagulation process, and additions of these factor, it is helpful for to prevent the hemorrhage in the case of the accident or in the case of the severe hemorrhage. And the factors, so those decrease the blood coagulation process and helpful for storage of blood for longer duration by, that is the blood, by keeping the blood in a cold, that is a 5 degrees centigrade, while all enzymes are inactive, then so there is no blood coagulation process can be occurs. Or collections of blood in a smooth containers. Due to by keeping the blood in the smooth container, the platelets cannot be activated. So that's why, so there is no blood coagulation process can be occur. So that's why if you want to keep the blood for longer duration, means you should be collect the blood in a smooth containers. And as well as additions of certain anticoagulants, so those are also decrease the blood coagulation process and helpful for to keep the blood for the longer durations, like protamine, cysteine, heparin, hirudine, dicomorin, and phenidine. So these are the anticoagulant. By addition these factor into the blood, so they can retard the blood coagulation process. And as well as the removal of the ionic calciums from the blood, then also we can keep the blood for longer duration by avoiding the blood coagulation process, like citrates, oxalates of calcium, sodium iodide. So these all are chelate the calcium, because calcium is a cofactor, it is required for the various blood coagulation process. So due to these factor, we can store the blood for longer durations in a blood banks. Okay, so then the factor they can accelerate the or hasten the blood coagulation process are heat. As the temperature increases, the enzyme activity is increases. So due to that, the blood coagulation process can be increases. Then as well as pressure on the capillaries, then also the blood coagulations can rapidly occur. So already you know, in the childhood when you're having the injury, your mother or father, any your neighbor, they can pressurizing on the site of the injury. Okay, they're putting their hand to the with the pressure. So that pressure on the capillaries or site of injury to helpful for to accelerate the blood coagulation process, are helpful for the formations of the blood clot. And as well as additions of thromboplastins or admission of thromboplastin, thrombin, ionic calcium, vitamin K, adrenaline, lipids. So these all are essential for to accelerate to increase the blood coagulation process. And additions of these factors is helpful for to prevent the hemorrhage in the case of surgery or in the case of the any internal and as well as the external injury. Okay, so like that we can accelerate the blood coagulation process as well as we can decrease the blood coagulation process.